Hi, my name's Elise. I'm the nurse practitioner with Go Medical, and here with me today is Edith, one of our medical assistants. She's going to be asking me the most common questions she has received during this COVID epidemic.
Okay, so one of the main questions that we've had is when should I get tested?
It's a great question. So you definitely want to see if you can get testing if you know for a fact you've been exposed to someone with COVID-19. And by exposure, we're talking about more than 10 minutes within that 6 feet of social distancing space. Other reasons that may qualify for testing, if you think you may have been exposed, but you're not 100% sure, or if someone close to you or yourself begins showing symptoms. And those symptoms of COVID can vary.
And that's the next question. What are the symptoms to look out for?
Right. So some of the most common that we hear about symptoms of COVID are that dry, deep cough, high fever, and body aches. But recently we've had more research that shows us that there are other things that could be COVID related. Sore throat, loss of taste, loss of smell. So really, if you're feeling ill or you have any symptoms you can't explain, the best thing you can do is to call your primary care provider.
Thank you. Another thing that we've been seeing a lot is we've had a lot of positive PCR. Can you tell us what a PCR means?
Right, so the PCR test is a nasal or oral swab where we go in and we actually are looking for virus. When that comes back positive, there's a little bit of confusion as to what that means. A positive PCR just means you have the virus in your body. It may or may not be live virus. That's why serial testing, where if someone asks you to get tested multiple times, or the quarantine period of 10 to 14 days, depending on when you were exposed and some other factors that your healthcare provider can help you identify, that's why that's so important. If you're shedding live virus with a positive PCR, you really don't want to be around other people. That's putting them at risk of developing COVID. If you're shedding dead virus, like what's given in vaccines, it's much less concerning. So the PCR test can be difficult to interpret, which is why we really suggest that you do obtain this test with the advisement of a healthcare provider.
Okay, and then another question that we've commonly had is, why am I positive PCR, but I haven't had not one symptom?
So that's a really great question. As we learn more about COVID, we're discovering that there are a lot of people who are what we call asymptomatic carriers, which means they're carrying the virus, capable of shedding it and giving it to other people, but they have no symptoms to speak of. So that's very difficult to identify. That's part of why we've had such a hard time containing this virus. For that reason, that's why social distancing is so important. Maintaining good 6 feet of distance between people and wearing your mask when you're around others is really important, and that's how you help keep not only yourself and your family safe, but also those around you in the event that you are shedding virus, but not actively having symptoms.
Thank you. And now let's talk about antibodies. We've also tested many with the IgG. Can you tell us what a positive IgG stands for?
Yes, that's an immunoglobulin. It's talking about antibodies to the virus. IgG takes about 14 to 21 days to really be developed at a level in your body that we can detect it. So if you have a positive IgG, it means you were exposed to COVID at a minimum 14 to 21 days before. IgG stays in your blood for months, sometimes even years. So it doesn't give us a very accurate time frame unless we know when you were exposed or were concerned for recent exposure. There are other types of antibodies that we can test, but they're not as accurate and they don't last as long. So really IgG is quickly becoming what I would consider the gold standard of antibody testing. What was the other part of that question?
It was just, what does the antibody mean?
Oh yeah, so antibodies are our body's way of defending against an outside invasion. So every time you get sick, your body's response to it, an antibody is created. The problem with COVID is it's such a new illness that we don't really know how effective our body's antibodies are against it. Likely some sort of a protection is provided once you've had the virus against getting it again. We just don't have enough research to really know if that's a fact that it will prevent you from getting COVID again.
Which was my next question. Can I still get sick if I am positive antibody?
Yes, so we're really not sure. Likely you can still get mild symptoms, but really the bigger risk is that you would still be a carrier again. So as your body fights off COVID, even if you don't get sick or as sick the next time, just like with our asymptomatic carriers, you could expose other people, which is why we get back to, again, our social distancing, wearing a mask, good hand hygiene, and bleaching or Lysoling as many surfaces as you can.
And also, we've also had a lot of questions of, should I get retested, and when is the proper time from a positive to hopefully a negative PCR?
Right. So this is, again, it's an ongoing, developing, interesting area of medicine. Retesting can be effective, especially for negative tests. If you have a negative PCR and then a day or two or three later you have another negative, the likelihood is you're not shedding the virus. So that gives you the knowledge that you're probably safe to be around others. That being said, if you were positive, some people are positive shedding the virus for weeks, sometimes even, I think the most I've heard is 3 months. They still tested positive for the virus, which obviously is outside of that quarantine period. And as I mentioned earlier, we don't know if that's live virus, dead virus, what that is. So there is some benefit to retesting in the appropriate circumstances, but absolutely under the care of a medical professional who is up with the latest research and information so that can be determined appropriately.
And last but not least, we've had multiple people that live together, spouses, children, and only one of them got infected, not the others, even though they're all under the same roof. Why is that?
You know, like I said, we still don't know a whole lot about this virus. If that family was practicing good social distancing at home, where when someone got sick, they put them in their own bedroom, had their own restroom, were wiping down surfaces, most likely they were able to protect themselves from getting that virus. Outside of that, I don't really have a good answer for that because this virus is so new and we don't know. The best thing you can do, even at home, is to, again, wipe down your surfaces, make sure you're sanitizing and washing hands really well, and anyone who does become ill, making sure that you isolate them in a way that they aren't exposing the rest of the family.
Perfect. Well, that is all. Thank you so much for your help.
Thank you for your time.
Thank you.